Good morning, student. Today we are going to see physiological changes during puperium. Which are the physiological changes occurs during the puperium period? Okay. So objective in this topic we have to go through these all objective. Introduction to puperium. Explain anatomical and the physiological changes during the puperium. So puperium means what? Puperium is the period after childbirth during which the body tissue, especially the pelvic organ, revert back approximately to the pre-pregnant state, both anatomically and physiologically. Means what? The puperium means after the childbirth, the pelvic organ, that is uterus, ओके, पेल्विक ऑर्गन रिवर्ट बॅक मीन्स सगळे जे पेल्विक ऑर्गन असतात ते ॲनाटॉमिकली आणि फिजिओलॉजिकली त्यांच्या नॉर्मल स्टेजला परत येतात, त्यालाच म्हणतात प्युपेरियम. अँड इन्व्होल्युशन इज द प्रोसेस Involution is the process whereby the reproductive organ return to their non-pregnant state. Duration. The puperium being as soon as the placenta is expelled and last for approximately 6 weeks when the uterus become regress almost to the non-pregnant size. The period is arbitrarily divided into immediate within 24 hours, early up to 7 days, remote up to 6 weeks. Reproductive system changes. Involution of the uterus. Anatomical consideration. Immediately following delivery, the uterus become firm and retracted with alternate hardening and the softening. The uterus measures about 20 meter in length, 12 meter in width, and 7.5 is the breadth centimeter. So weight about 1000 gram. Anatomical consideration. At the end of first week, the it weighs 500 gram. By the 6th week, it weighs approximately 50 gram. The placental side contracts rapidly, presenting a raised surface which measures about 7.5 centimeter and remains elevated even at 6 weeks when it measures about 1.5 centimeter. Lower uterine segment. Immediately following delivery, the lower segment become thin, flabby, collapsed structure. It takes a few weeks to revert back to the normal shape and size of the isthmus. Cervix. The cervix contracts slowly. External os admit to fingers for a few days, but by the end of first week, narrow down to admit the tip of finger only. It never return back to the nulliparous state. Usually remains slightly open and appears still like a satellite star shape. Internal os closes as before. Physiological consideration. The physiological process of involution is most marked in the body of the uterus. The changes occurs in the following component: muscle, blood vessels, and endometrium. The muscles. During the puperium, the number of muscles finger is not decreased, but there is substantial reductions of the myometrial cell size. Withdrawal of steroid hormones, estrogen and progesterone may lead to increase in the activity of the uterine collagenase and the release of the proteolytic enzyme. Blood vessel. The arteries are constricted by contractions of its wall and thickening of the intima followed by the thrombosis. New blood vessels grow inside thrombi. Fibrous tissues on the wall undergoes hyaline degenerations and the products are removed by the macrophages. There is also degeneration of the pelvic elastic tissues. Endometrium.